Welcome to today's webinar, Infant Adoption, Update for Health Professionals, Trends, Laws, and Best Practices. I am Amy Gold, Director of Education for the Partnership for Maternal and Child Health of Northern New Jersey. The partnership is providing today's program. A few pieces of information to share with you before I introduce our speaker. The speakers and planners have no relevant conflicts of interest to disclose. To receive a certificate of completion for this program, you must listen to the entire webinar and complete the evaluation survey. A link to this survey will be sent to you by email within 1 hour after the conclusion of the program. Certificates of completion will be sent via email by the end of this week. This program is being recorded and will be available through the partnership's on-demand education page until November 9th, 2022. Although we have muted our attendees' microphones, we encourage you to enter questions in the question box, and our speaker will address them during the presentation. And now I'd like to introduce our speaker for this afternoon. She is Meredith Rose, the Director of Open Arms Adoption Network. Meredith has been working with families in the field of social work for over 20 years and happily found her place in open adoption in 1996. Meredith holds an MSW and an MPH in maternal and child health from the University of North Carolina, Chapel Hill. Good afternoon, Meredith.
Good afternoon. Thank you so much, Amy. Thank you all for joining us today. So yes, as Amy said, I'm Meredith Rose, and I do have a co-pilot whose image is not here, Jenny Sved, who's our outreach coordinator with Open Arms. She's here to really help me should any technical issues arise, and she's the person that's clicking me through the PowerPoint. So if you hear me say, please move us ahead, Jenny, that's what's going on. So thank you all so much for coming, and thank you so much for the Partnership for Maternal and Child Health of North New Jersey. We're happy to be here with you today. So today is really, we're together just for an hour, and my hope for this and for similar trainings that we do that are of this nature around an hour is to really just provide people with a brief orientation into contemporary adoption. Adoption looks so different than it did. If anyone on this webinar is over the age of 30, which I'm sure many of you are, adoption looks nothing like it did when, for those of you who are 30 or 40, adoption can really be a really empowering, wonderful option for a woman who finds herself pregnant at a time when she doesn't feel she can parent, or perhaps there's other issues going on in her life, which we will talk about later, that makes it so voluntary adoption might be an option that feels really good for her and that she's making the best choice for her child. So I hope you have an open mind to this, and chances are you're going to walk away and just feel a bit more informed about contemporary adoption. And Jenny, can you go to the first slide, please? So we're going to start with a poll, and I'm going to read it to you, and then Laura is going to tabulate the results. And you may find this to be an odd way to start, but I gave it some thought, and I think it's kind of a nice way to start. So here's our first poll question, and this is a chance for you all to participate and be a part of this training. We have about 4 polls we're going to do throughout our hour together. So as you see, the question says, what is the way most women say they learn about the option of adoption as an alternative to foster care or as an alternative to parenting when it is not possible or the right option for them? So your 4 answers to choose from are 1 from the internet, 2 from their friends, 3 from professionals, and 4 from TV and movies. And there we go. So as you can see, here is the poll written out. And what do Laura, is it obvious how people would be able to click on each option?
Yes.
Okay, great.
We'll just give it a few more seconds.
Sure. Thank you.
Go ahead, Meredith. We'll give
So
it
if
a few more
everyone wants to
seconds,
give
and then
this
we'll look at the results.
Okay, great. So we'll be curious to see what your results are. And I'm going to go ahead and tell you why I am asking this question. Fantastic. Great. Wow. Yay. These are the perfect results that I would have dreamt up if I could have created a learning slide. It would be this. So it looks like almost half of you said from TV or movies. That's 42%. Then the next group of you said from the internet, which is 29%. The next group of you said from friends, 21%. And then the final group of you said 8% from professionals. So the reason this is fun for me that you all voted this way is it's actually reverse. Women who are truly contemplating the option of adoption are most often, this is what they tell us, are most often learning about the reality of adoption from professionals like you, from people who are nurses, from people who are social workers, people who are therapists, clinicians, people who work at shelters, or with women who are struggling with addiction or mental health issues. That is actually the place where women who are seriously contemplating adoption say they learn about adoption. So so the reason I'm glad that we did this poll and glad that you had that answer, because it gives me the chance to tell you that, which it sounds like it's probably a bit surprising. And I just like to say this at the beginning, because the truth is, we as professionals, I've been working in social work for 25 years, and before I found adoption, I was working as a hospital in labor and delivery. I was working in shelters. I was working with women in addiction. And I worked with a lot of women who found themselves pregnant at a time when parenting was not the right option for them or their baby. And they were unable to find the information that they needed to learn about it. And these women found a way to reach out to us, whether it was like looking around the wall and seeing if there were any posters about adoption, whether there were any brochures sitting in clinics, in hospital waiting rooms, in doctor's offices, in shelters, in community centers. Women were like looking around for ways to find information, but then what I have heard over the years is what it really is when a professional gives them a moment and notices that there's things going on for them, perhaps that are making them feel insecure about parenting, or maybe they're outright admitting that parenting right now is not the right choice. It is the professional that, what we have found, if they are educated about community options and adoption, they're the ones that are helping women learn about how to take the next step. So I'm so glad you all are here. And I was looking at the list of attendees. We have a bunch of people, of course, from Partnership for Maternal and Child Health. We have a bunch of people from Isaiah House, Atlantic Care, DCPMP, Healthy Women, Healthy Families. So we've got a lot of different professionals. So I'm really glad you're here, because the truth is, it always comes down to you. Like, you're the one. If you learn about this, just like you guys learn about how to stop smoking, what to do when there's domestic violence happening, what to do if you're struggling with addiction, adoption is just yet another community option. And professionals often don't know enough about this to be able to bring it up as an option. So I just like to say this at the beginning, that we always think it's somebody else, like the person who provided the prenatal care. Well, I'm sure she spoke about the option of adoption, or I'm sure her DCPMP worker mentioned that she could make an adoption plan if she chose to, or perhaps the labor and delivery nurse who's been with her as she's been upset all night. I'm sure she brought it up. The truth is, we're all so busy, and that person who you're sure brought it up probably didn't, just because of time constraints. So it's you. It comes down to you. So I just like to say that at the beginning, and I think it's a nice way to start. Can you go to the next slide, Jenny? Okay. So here's just a preview of what's to come. So we call this 1 hour class adoption law and something else, I forget. And here's our agenda. So we're going to highlight a little bit about what adoption was like then and now. We're going to talk about the continuum of openness in adoption. We're going to talk about what's accurate adoption language and why does it matter for you to learn what's accurate language. We're going to do a quick overview of the adoption process. We're going to highlight birth mom law, and we're going to also highlight birth father law. And we're going to talk about what's the role of the adoption agency within a hospital, and also, of course, to reflect on what's the role of an adoption agency with you if you're not in a hospital, because I know most of you are not. So we're going to talk about that. And I also want to say one second before I move forward is that we're not here to promote adoption, not at all. This is only to educate you about adoption. And I will always speak in general terms. I'm not speaking about our agency in particular. I'm speaking in general terms. Okay, so just to highlight a little bit about adoption then and now, but I do have to say all the cute pictures you're going to see are families from our program, which is fun for Jenny and me anyway. Okay, so just to sort of remind you about what adoption was like perhaps in the 60s and 70s and 80s, for those of you maybe who are unaware, compared to now. So back in the 60s and 70s, adoption was seen as a one-time event. And now adoption is a one-time legal event, but it's a lifelong experience for all. Then adoption was all about secrecy and shame. And I'm sure almost all of you know that. But now adoption is an open topic. Adoption agencies are really charged with providing non-coercive counseling. Social workers help women face the grief, loss, and joy in the process. Then adoption, as you know, was confidential. As you guys likely know, even if you're in your 30s, you likely know that adoption back in the day was really a kind of thing where you never told anyone you were pregnant. Your parents didn't tell anyone that you got pregnant. You were shipped off to some aunt in the middle of the country and they made up some story about where you were. No one was to know. And then you gave birth and baby was swooped away from you and you didn't know if it was a boy or a girl. You didn't know who was going to adopt the baby. And you were encouraged by your professionals back then in the 70s and 60s and your family to like pretend it never happened and everything was hush hush. But now in adoption, it's not hush hush. What we know from our work and research of 60 years studying adoption is that talking about this, being open and honest about this, helping a woman assimilate it into her life is what is most healthy for her. So now in adoption, we've learned from practice over these years that what has been created is a continuum of openness. So staying in contact with your child through an open adoption or semi-open adoption is very much available to women in all agencies, as well as confidential adoptions are also still available. Back then in the day, adoption was only for baby with 0 issues. And I put 0 issues there. I know that sounds a little awkward, but it was really for babies who were full term, who were born weighing a nice healthy weight, 8.5 pounds, who birth mom had no issues, such as no mental health issues, no issues with drugs or alcohol. Baby was not at all premature. Baby emerged into this world looking like, quote unquote, perfect. But now in today's contemporary adoption, I think you got to click it, Jen, I think it'll come up. It got unstructured a little. In today's adoption, you'll see next to where it says for babies with 0 issues, voluntary adoption is for all children, regardless of any issues present, such as drug or alcohol exposure, any known significant history with mental health, any medical or neurological issues known with the birth mom. And this is really important for you to know because there is sort of an assumption I have found that if a woman is pregnant with a baby and is really considering adoption as the right choice for her and her baby, and then perhaps she learns via ultrasound that there's something enormously wrong with the developing baby. Just last month we had a situation where everybody thought everything was fine, but then through an ultrasound they then did an MRI and they noticed there were some major significant issues with the heart. Sometimes it's even revealed that a baby has Down syndrome. And then other times we just know from our having a relationship with the birth mom that there's been extensive use of drugs or alcohol. So back in the day, babies with any of these situations going on that I just mentioned, there were no homes available for them if a birth mom needed to make an adoption plan. Children with anything going on were sent to orphanages back in the day, like group homes. And now, thankfully, there's always families, wonderful families, totally prepared to adopt children with any issue going on. And I know in our practice and in many other voluntary adoption agencies across the country, probably over 50% of the women we work with are actively using opioids during their pregnancy. They may be in treatment and getting supervised methadone or Suboxone treatment, or they may be using heroin or other drugs. And in our program and in most other adoption programs, adoptive families are very much available and ready and prepared to adopt babies that may have been exposed to opioids, and they've received training on how to be with and work with a baby with NAS and how to do all that extra special care in the NICU and then once at home. So I just like to point out that there are wonderful families for every baby when a birth mom thinks adoption is the best choice. Excuse me. And then also, then it says straight married Christian adoptive families were the only families who were eligible to adopt babies. You had to have a long list of fertility challenges also. And now, as you all likely know, all people are welcome to apply to adoption agencies to become parents. LGBTQ individuals are welcome. LGBTQ individuals and couples, straight individual people and couples, and also single people. Then in the then category, as you guys likely know, you all may have had friends or family members who maybe chose adoption for their baby, or more likely, if you have friends or family who at this point are 50 or 60 years old, chose is probably not the word they were used. They were perhaps coerced into making an adoption plan because, as you know, it was just becoming pregnant when not married, there was just so much shame put on these women, and shame was brought on the family. So staying in contact was completely impossible because the idea was to pretend this never happened. So back then, no ongoing contact, no information shared between birth and adoptive families in adoption was absolutely the norm. Now, if you look under the now category, child-centered options for ongoing contact is what we do. A lot of women know that staying connected to their child is available to them, but they choose to not do that. In most agencies, people would say maybe half of the women, even though they know staying connected to their child is a possibility, and the adoptive families would love this. Probably I'm going to say like a third of the women choose to not stay in touch at all. And that's very much an option. But most agencies say to these women, I get that's where you are right now, that you don't want to stay in contact, but should you choose to be involved with the family through pictures, letters, or visits down the road, agencies, for the most part, most agencies ours certainly does, but I think most agencies too would welcome a woman to come back and say, you know what, now I'm feeling a bit more healed up and strong, and I would like to see pictures and get updates and maybe even establish a relationship. Okay. And then finally on this slide, adoption language was super judgmental and negative, and you may not even be aware of that. And we have a slide to sort of help you think about, wow, the way we used to speak was really quite judgmental and laden with shame, even though we don't mean to do that. And now there's a focus on speaking in a neutral way, which is just the accurate way. And it's pretty similar to any field any of you all specialize in. We all have a certain language that we want to put out to the community that brings the shame away from our clients, such as those working with people struggling with addiction. 10 years ago, we used to say, I work with addicts, and now we don't say that. So we're growing and learning and altering our language to create an atmosphere that is one of no judgment. So we'll talk a bit more about that in a little bit. Okay. So I'm just going to highlight for you a little bit about the continuum of openness, but I also want to say for those of you who are standing by hoping for something exciting to happen, we do, after I'm done this slide, we do have a young woman named Amanda who is a birth mom who has worked with our agency for, I think we've known her about 6 years because I think her son is 6. So she's coming up right after this, so I think you'll enjoy hearing from her. So now this slide is just to sort of highlight what is the continuum of openness, what is that and what does it mean? So, as I pointed out, in adoptions of the past, everything was closed, confidential. Like I had friends, I'm 55, I had a friend who made an adoption plan in high school, and I saw her at a high school reunion, and I just had to tell her that I work in adoption, and we started talking about her life and her child, and she has no idea what happened to her child. She doesn't know the sex of her child. Her child was whisked away. It was all confidential. And she has attempted to find out a bit about her child. She's made her information known in the file at the agency she worked with, but it was all 100% confidential and hush-hush. But nowadays, what we find nationally is maybe about 20% of adoptions are confidential, and that's because the birth mom is requesting that for her own reasons. And in confidential adoption, of course, there's no identifying information exchanged. There's an assumption there's no future contact. And that's very much an option for women, but I do like to warn professionals that if a woman, a patient or client of yours is working with there are some like national adoption companies, I just want you to know that all agencies across the country do offer open adoption, semi-open, and confidential. A woman's option is not exclusively a confidential adoption. So if she ever finds herself with an agency that's only offering her that, please know all agencies, 90% of agencies will offer women confidential, semi-open, or open, not just confidential. Okay, so a little bit more about what's a semi-open adoption. As you guys may know, from perhaps you have friends who've adopted, perhaps you've worked with women who've made adoption plans, perhaps you yourself have made an adoption plan or read about it. Staying connected is a possibility in contemporary adoption. And the middle arrow says in semi-open adoption that happens around 40% of the time. And that's when there's a connection between a birth family and adoptive family. There's no identifying information typically exchanged. So they would know me if I'm the mom by adoption. They'd know me as Meredith, and I'd know her as Evelyn, and we maybe have a non-identifying email, and we communicate and get together. Usually if it's a semi-open adoption, there's somebody else involved, like an adoption person who is sort of the person involved who brings everybody together. My experience over these years, when folks start out in a semi-open adoption because perhaps the adoptive family is eager for that, or the birth mom just wants more structure, my experience is they kind of open up over the years because you just become very well acquainted with each other. Sometimes you even end up feeling like family. So having that third wheel there, meaning someone like me in the room, is just kind of awkward. So usually they just kind of open up and we communicate directly. And then on the right is an open adoption, and 40% of adoptions in our country are what we call open, and that's where eventually parties, the adoptive family and the birth family, disclose identifying information. They get together on their own. They say, hey, let's hook up, how about the week after Christmas? Okay, great. Or let's get together around the baby's birthday. Okay, great. And you hang out and spend time, and it's people, adoptive families and birth families often head into this with a lot of angst because it's like scary. It's complex. We've never done anything like this before. But in my experience, it really eases up rather quickly because like the birth family is so excited and grateful that this connection exists for them, so they can know their child, they can share their love with their child can know they love them, and then the other way around, so the child gets to be loved and validated by birth mom, and then the adoptive family doesn't have to walk around with all of these big questions, but they can actually have this connection. And I am a happy parent through adoption. I have 2 children who were born to me. My son, I didn't say that right, that's not true. I have 2 children. My son was born to me and he's 24, and my daughter we adopted and she's 22. And so we've always enjoyed this really lovely connection with my daughter's birth family over these 22 years. So she gets who her parents are day in and day out, but she also knows and loves the good people that gave her life and that made this decision for her, and who give her all her interesting qualities and characteristics and talents. And so it just sort of, grounds her, makes her know where she is. And so she's never like looking over her shoulder. She gets it all. And this is her family. And there's no secrets and no wondering. And a lot of people would describe it as just sort of helping children who join their family through adoption just have the answers. So this is their life, and this is a good one. Okay, next slide, please, Jenny. Okay, so here's another poll question. Poll number 2, the concept of open adoption is a newer practice that has become popular in the past few years. So please select one, yes or no. Okay, and I know everyone's working on that. I'll just say a couple more things. When we say open adoption, please know that open adoption is never co-parenting. Like what open adoption is, it's like a birth family and an adoptive family saying, hey, we think staying connected for the sake of our child is the better choice for our child. But the people who are parenting are the parents. They're the sole legal guardians. They're there for all the good stuff. They're there for all the tough stuff. They're it, tag, you're it. But the birth family in an ideal situation, like what Amanda will talk about, they're considered like an extended member of a member of the extended family. Great, I love it that this is the answer too. I'm so glad you guys are here. So what I was saying was, so it's never co-parenting, and in most open adoptions, getting together 2 or 3 times a year is most typical, and exchanging pictures and letters in between is most typical. Hanging out every weekend is something I've seen in movies. I've never seen that in real life. 2 or 3 times a year is what I see as most typical. So check it out, look at your answer. The concept of open adoption is a newer practice that has become popular in the past few years. 84% of you said yes. It's actually not at all a new practice. It's been going on since 1970. It was started in the 70s when clinicians across the country started to notice that there was this unnecessary angst and grief that was placed on birth moms who were told, time to move on with your life. This never happened. I don't ever want to hear it again. They would move on into future relationships, perhaps have other children, and never get to talk about the fact that they made an adoption plan and that they had a child out there. They'd never have the healing of knowing their child is happy and well and doing beautifully. So clinicians started to notice that. They also started to notice the whole secrecy and shame thing was super tough on adoptive families. Like pretending that this child was born to you and like lying to your child every day that they came from you biologically is tough on adoptive families. And of course, it's super tough on children when they're, 20 or 30 years old and they're rummaging around in their parents' attic and they find a birth certificate that has their name on it and has their date of their birth and the hospital they were born in, but that's not their name. And then they're like, wait, what happened? What is this? What is this, Mom? And, for those of you who are over 30, you remember all those Oprah episodes. That was a common thing that kept happening. So open adoption enables us to, remove the secrecy, remove the lies, and just acknowledge the wonderful way our children have have come into our family, and to acknowledge the good place that they came from. And it allows everyone to be open and honest. And I don't pretend that this is easy. It's complex, but complex is okay. And children who join our family through adoption, if there's enough good counseling that takes place, it's happening for a very good and important reason. So can we go to, okay, great. Okay, I think, yes, I think we're up to Amanda. Now, Amanda is this wonderful woman who does a lot of presenting for us in person, like pre-COVID. Amanda has been doing presentations for us, for professionals just like you, and for our incoming adopted families. We have about, I don't know, maybe 10 different birth parents who are brave enough to speak in front of a room of strangers and share their most personal story. And then now with COVID, thank you, Amanda, for being brave enough to share your story via Zoom. And Amanda is on her phone. Yes, thank you.
I am. Sorry.
And so Amanda is on her phone, so you won't be able to see her, but you can. But if you guys are all looking at these precious pictures, you can obviously see Amanda. Jenny, do you have a pointer thing? Can you use your cursor? Yeah, so there you go. There she is, but she's very pregnant there. And that's Brad and David, the two men that she chose to be parents to her son, Noah. And then you can see Brad and David holding Noah as he's growing. And Amanda, I think that might be your birth mom with you, with Amanda, but I mean with Noah. That's a beautiful picture. And then the three lower pictures are Noah growing up being ridiculously precious. So Amanda, I'm going to shush, and can you like share? So on our Zoom today, we have, people that are nurses, other clinicians, social workers, people who work in hospitals, clinics, shelters, all different kinds of professions. But if you can just kind of share about, learning about that you were pregnant and the process that you went through to consider adoption, and then we'll kind of go from there. And Jenny will let us know how much time we have because I'm not sure. Okay.
Sure, no problem. So I was about 12 weeks when I found out I was pregnant. I was living in Florida by myself. I just needed to get away, and I ended up getting pregnant, and I didn't know what to do. Obviously calling friends and family and just kind of search for hope and just an answer. I was in no way, shape, or form capable or even had the means of taking care of a child on my own. And so I was just terrified. I went through everything I could to try and get an abortion, calling different clinics, and, again, just not knowing what to do. And one of my best friends actually kind of talked me down from getting an abortion, and kind of stirred me to open arms and was like, hey, kind of do your research and look into them. And she also had a friend in open arms as well. And so she kind of gave me her number, and I called her and talked to her. And I don't want to say she talked me into adoption. She was definitely there for me and said, if adoption isn't for you, we'll still get you the help you need. If you do want to take care of this baby, whatever it is that you need, we will help you with it, whether it's adoption or, if you do want to go the abortion route, or if you do want to keep the baby, we'll find every option you can. And so doing my research and looking more into open adoption, it was definitely for me. I wanted to know more about the baby, and I didn't want, like you said earlier in the webinars, I didn't want him just whisked away and not knowing what happened to him or who's adopting him or who's taking care of him. And so it was really important to me to know the family and, to know how they're going to raise him and stuff like that. And so, going to open arms was definitely the right choice for
Okay.
me.
Amanda, can you talk about, what it felt like in the hospital for you, and sort of talk about the hospital, the nurses or social workers you interacted with? How was that for you?
Yeah.
What was important when you were in the hospital?
So everybody at Open Arms was 150%.
You don't have to talk about Open Arms.
Okay. So at the hospital, it was a little bit difficult. So I guess like a lot of the nurses there just, I don't want to say they were disrespectful. I think they just didn't know like what was going on. And so when I gave them my request, I asked them, not to put the baby on top of me, or not to call me mommy or mom, or, just no information about, I guess, like feeding the baby and stuff like that. And they still did. And it was really rough, and it was really difficult, kind of going through that. They They just didn't listen to anything I said. I said, please don't call me mom. And, you know, the nurses still called me mom. And it's hard, you know, like we're going through a rough time. You know, we're having a baby. We're giving up our own child to another family to raise because we're either, you know, ill-equipped or we just can't do it on our own. And so having someone call you a mom when knowing you're not going to be a mom was a little rough and a little difficult. And so we kind of had to have patience with that. But I mean, in the end, it was a little bit of a struggle, but you know, obviously I managed to get through it.
Amanda, is Noah almost 6?
He is 6. He just turned 6 last March.
He's
so
6.
he'll be
Okay.
yeah, he'll be 7 March 27th.
Okay. And can you tell our group what it's like to stay connected to Brad, David, and Noah? What does that feel like for you?
It's really great just knowing like how he is growing up and what he's going through and what he's doing. And I'm just a nosy person naturally. And so, you know, the constant connection is really good for me. I get to see him all the time with like pictures and stuff like that. And, you know, we email back and forth, which is great. And they update me on everything that's going on with him. You know, unfortunately, because of COVID-19, I have not seen him in 2020. So hopefully 2021 brings a new year and hopefully I'll be able to see him. But in normal times, the past, I'm gonna say 5 years, I've been able to go and see him for birthdays and, you know, for Thanksgiving and for Christmas and different family events that they would have. If they have like a get together or a birthday or a cookout, I was able to go because to me, well, for them, they look at me like I'm just another part of the family, in all honesty, and it's beautiful and I love it.
Mm-hmm. Well, thank you so much, Amanda.
Of course.
Normally we do questions and answers with Amanda, but I don't even think we have time since we only have an hour completely together. But,
Okay.
you know, I just like to thank you so much. And Amanda also she always says this, which is just sort of extra interesting, is she's an adopted person herself.
I am. Yes, I was adopted.
And yes. And so this process was like extremely poignant for her on so many levels. And that's your birth mom on the right.
Yes. Yep.
Before Amanda goes off, this is Amy. We do have one question, if you'll entertain that.
Of course.
The question is, was the father involved in your decision for the baby?
He was. So in the beginning, I gave him all the options we actually talked about keeping the baby and then realized with him living in Florida and me moving back to Pennsylvania, it just wasn't really going to work out. And so I talked to him about adoption and it just didn't work out for me and him. He didn't want to have any parts of that. And so he said, if you're going to give the baby up for adoption, I don't want to have anything to do with you or the baby. And so I was absolutely fine with that. He signed over his rights and, you know, we kind of pushed forward after that. And it honestly, it made everything a lot more smoother without him in the picture because I was able to pick the family that I knew that would raise him the way that I wanted to see him raised. And everything has just been perfect.
Thank you, Amanda. We have one more question.
Sure, no problem.
So one of our listeners wants to know what Noah calls you.
So when he was younger and he was like just learning to talk, he would call me uh-oh. I don't know why. He just he would always like look at me and be like, uh-oh. So I thought that was kind of funny. But now he'll either call me Mandy or Mom.
Mm-hmm.
Thank you.
Yeah, no problem.
And for those of you who yeah, hearing that Noah may sometimes call her mom, that probably some of you are going, huh, wait, how does that work? Well, these are two men who are parenting Noah, but in a situation, if you have two moms, or if you have a woman and a man parenting, or a single woman, obviously children having having two people in front of them both called mommy doesn't work. And usually the person who is called mommy, if there's an adoptive family involved, an adoptive mother involved, mom is usually the one who's parenting. But in Amanda's situation, there's two guys, so it makes
and I don't think he meant to call me that on purpose. I don't think the guys taught him that. I've always had my picture's always been in his room, right above his crib or his bed, of me and his biological father. I told them that was okay. And so they've always pointed at those pictures and have said our names. So Amanda, he would always be like, who's that? It's Amanda. So they've never taught him to call me mom. I think just being around it was, I don't know, it was kind of like a natural thing, hearing his cousins call another woman mom. And then one day he just kind of said it to me. And I looked at the fathers like, is that okay? I don't know. You know what I mean? Like, it's kind of just touch and go. It's like, I guess we'll get to that point when we reach it, kind of thing.
Right. And the guys,
it's a learning experience.
And with all children, for all of you who are parents, we all know, there's developmentally appropriate ways to help children understand everything. So of course the guys are saying to Noah, you grew in Amanda's belly and she's your birth mom, and telling him the truth from the very beginning. But it takes children a long time to make the connections. But the thing that happens in contemporary adoption is the truth, is honesty. So that's always the way to go. All right. Well, thank you so much. Sorry we can't see your pretty face next time.
I'm sorry.
Thanks, Amanda.
No problem. Did you want me to stay on for questions after?
No, you know why? Because we're good, because this, like, at 3 o'clock, we're cut off.
Okay.
So.
All right. No problem.
But thank you
have
so
a wonderful
much.
day.
Thank you.
All right. Bye-bye.
Bye-bye. All righty. So yes, Amanda's awesome. So I'm going to start going really fast now because I'm seeing we have 15 minutes. So I mentioned at the beginning that, the way we speak matters. And here's just a slide to remind us about, accurate ways to talk about adoption. Here's some negative or judgmental terms. Give up, give away your baby, put your baby up for adoption. There's no way to say give away your baby in a light and airy way so it doesn't sound judgmental. It's like, oh, this girl, Samantha, she wants to give away her baby. Like, you can't say that without it being horribly judgmental for the person receiving it. And for those who don't know what put up your baby for adoption, like, I know that's a part of the vernacular. That came from like the 1800s when there was during the Industrial Revolution, when 150,000 children were placed on trains from the Northeast Corridor, where there was all kinds of poverty, New Jersey, New York. There were a lot of children with no parents because parents were like struggling and working in different cities to make ends meet. Children were in foundling hospitals and became homeless. And 150,000 children were put on trains and sent out west to find families, and they were put up on the train platform. So children who were put up for adoption were put on train platforms, and people would choose the child that would help them the most in their family. Like, you might choose a 10-year-old boy to run your tractor, to help on your farm. You might choose a 10-year-old little girl to help with childcare for your family. And I know that sounds crazy. It sounds like slavery. And from what I read, for some children, it was slavery. For other children, they were lucky enough and they found a family this way, but put up for adoption, thankfully, doesn't happen anymore. So we don't use that term. Instead, we say make an adoption plan or choose adoption, because this is planful. This is about choices. Women have choices, and an adoption is one choice that should be honored and spoken about in a non-judgmental way. Okay, next, Jenny. Okay, another, negative or inaccurate thing is keeping your baby. We work with so many women, like 80% of the women adoption agencies work with choose to either terminate their pregnancy or to parent the baby. So we're all very used to that. But when you choose to parent your baby, you're not keeping your baby, you're parenting your baby. So we like to help professionals acknowledge the difference. Like keeping your baby really is like, like the way nurses swaddle babies up so great in a little bundle. And like that's keeping, like we don't, if we could keep those, we'd probably keep like 3 of them, but we're not keeping them, we're raising them. So when you're working with a woman who thinks about adoption and maybe chooses against it, try to say parenting. So you're going to be parenting your baby, because that then reminds her and you and whoever else is in the room that we need to be serious about who's going to be raising this baby, who's going to be doing the 24/7, where is this baby going to be living, who's going to be taking care of this baby, what are we going to do about jobs? So it helps people think more deeply. It's not just keeping. Okay. The next one, real natural parent. We don't hear that as much anymore, like calling Amanda, for example, oh, she's the real parent. Everybody's real. I told you I'm a parent by adoption. I'm a real parent, and my daughter's birth mom is a real parent, but I'm the parenting parent. I'm the mommy. So we say in our world, birth parent, or instead of real, of course, because it's a more accurate term. Okay, so can you go down one more, Jenny, please? Okay, just a quick, again, I'm like, we've 10 minutes. So just a quick overview of the adoption process. So on one side, we have potential adoptive parents. Perhaps people deciding is the way we want to build or complete our family through adoption. Maybe it's through surrogacy. Maybe it's through, bringing in kin. Maybe it's through foster care. Okay, so deciding what to do. So suppose they select adoption, voluntary adoption, what happens? They research and choose an agency. There's lots of agencies in every state. Hopefully people who are thinking about adoption go to several adoption information sessions to find the place that feels right for them. Whatever agency they go to, there's a home study process. Lots of research. To get a home study done, you're looking at usually like 4 or 5 months. Clinicians in the home study agency and wherever agency you go to come into your home at least 3 or 4 times. Lots of clearances from every state you've ever lived in, FBI clearance, references from non-family members, from your employer. We need to know you're safe. And the biggest reason we need to know you're safe is agencies become the guardian of children for a short time, and we need to know the place where this baby's going to lie is a safe, loving place that's ready to parent right away. And most important, women who choose adoption are incredibly maternal. And the very first thing they want to know is, yeah, these people look cute on paper, but are they safe? Because mothers need to know their kids are going to be safe. So because families have so much to go through, we can at least say they're safe. Also, families create an adoptive family profile. We don't have one on, we don't have one to show you on the screen, but look, this is, how can I do it this way? This is like just an example. All agencies help adoptive families create these very long adoptive family profiles that, details what does a family look like? What do they do for fun? What's their extended family look like? What do they do for work? What kind of life, what kind of fun rituals is the child going to have? And in most women, with most agencies, have an opportunity to choose the right family for their baby. So that's different in today's adoption. Some women have this option, but actually don't want to choose, and that's fine too. So on the expectant parent side, we have an unplanned pregnancy, or perhaps it was planned, but then by the time of delivery, it was a really bad time. Like perhaps there's no support around, perhaps the woman always wanted to parent with her partner, and perhaps he's not there. Perhaps there's lots of other circumstances going on. So if a woman is considering adoption, hopefully she's getting non-biased options counseling from an agency where there's discussion about parenting. Perhaps there's family assistance or friend assistance to help her raise the baby if that's what she wants to do. Perhaps she's considering terminating the pregnancy, and adoption is just yet another option. No better, no worse, just another option. But if she chooses adoption, what happens? Hopefully there's lots of counseling with the adoption agency she's working with, open-ended adoption counseling. What's important to you? Talk about hopefully an agency counselor's talking about the grief and loss associated with not parenting your child. But we always are looking at everything with a maternal lens. And the best adoption agencies, I'm assuming you can't see that, right? I gotta get this off my screen, I'm so sorry. The best adoption, oh my goodness, sorry, hang on. Okay, the best adoption agencies are not, when a woman comes to you and she's 2, 3, 4, 5 months pregnant, I hope adoption agencies are not exclusively talking about adoption, because if you're 2, 3, 4, 5, 6 months pregnant, there's lots of options for you, including parenting with friends or family, or adoption should never, like, once a woman says, I want to do this, agencies should always help her revisit her other options, because perhaps when she's 8 months pregnant, her mom says, yeah, you can come live with me. Yes, we can raise this baby together. Or boyfriend says, yeah, I'm going to help you raise this baby. Maybe it's not his biological child, but maybe by month 9, he's saying, I want to do this with you, and they want to do it together. And that's a happy, safe decision. Hopefully the adoption agency is going to support this woman to do that. So women, once they're in an agency, again, opportunities to review profiles if she wants. If she does not, which a lot of women don't, then that's fine too. Okay, next slide, please. Poll number 3, and this is a lot of words, so I'm going to read it to you. Why might a delivering or new mom want to learn about adoption if her newborn is going into foster care? And these are your choices. She can choose the family she thinks is right for her baby. If she chooses voluntary adoption, she can stay in touch with the chosen family. She can feel empowered and maternal. She can provide her child with a loving family immediately, or all of the above. So if you can take a moment and answer that question, that will be great. And the reason this is important is a lot of you work with women whose babies might be heading into foster care. I've worked in foster care, and I know lots of times there are women who just need a little bit of assistance. Perhaps DCP&P or whatever state you're coming from might assume custody of the baby for a short time while this woman gets into rehab or gets housing or gets that extra support from a family member. And there's great hope that that baby is going to be able to go back to this woman in a couple of weeks or a couple of months. That's fantastic when that can happen, but sometimes that's not going to happen. And we know that sadly, this woman may have, non-managed mental health. She may have 2 or 3 other children in foster care she hasn't been able to get back. She may be, sadly, chronically homeless and no support. So I want to say to all of you that 50% of the places that call us for help and who call other agencies are professionals who are working with women whose children are heading into foster care, and they just sort of know they're not going to be reunited with their children just because of lots of different circumstances. And if clinicians like yourself bring up the option of adoption, voluntary adoption, and choose one of the many good voluntary adoption agencies, a woman can have a whole different experience, choose a family, stay in touch, and have her child know her. So you guys all answered that correctly. So happy, all of the above is true. Okay, next slide, please. I have 5 minutes and gonna go super quick. Tips for professionals, and I know you're from all different disciplines. We encourage you to use non-coercive, non-directive communication to offer all options to your patient or client. We encourage you to bring up the option of adoption as just another available path. No values, not any better, not any worse. It's just another option. To meet the needs of baby. When new moms or pregnant women are concerned that parenting a newborn may not be the best choice for their baby's well-being. Get comfortable offering this option to all your patients and clients, just as you're comfortable talking about all other community services out there. The next thing says voluntary adoption can be an alternative to foster care or safe haven. Please just remember that. I've worked with many women whose babies were heading into safe haven, meaning they were going to surrender the baby to the ER and they were going to walk away. When the social worker or nurse took a second to say, hey, you mean you can't parent your baby, or you are unable to, you don't think you have what you need to raise your baby, you don't need to do safe haven. You can call a voluntary adoption agency, and those women will be, treated with so much dignity, and they'll be able to sleep at night knowing their baby is not in foster care. Because safe haven, as you likely know, babies go into foster care, are usually cared for by a loving, wonderful foster care parent, of course, but they could go into multiple foster homes until they're adopted. So keep in mind, voluntary adoption is another option, and women can just feel empowered and feel safer that their child is going to a place that they determined is the right place, and they can stay in touch. And again, in the bottom bullet, you are not promoting adoption. I am not promoting adoption. We're really just educating people about it so they can make an informed decision. Okay, next slide. Okay, real quick. If an adoption plan has been in place for several months during your patient client's pregnancy, and she and the hopeful adoptive parents have been communicating over these months, who should be making decisions for the baby during the time that the newly delivered mom is in the hospital? Is it 1, the adoptive parent, or 2, your patient or client? So this was nicely shortened by Laura, thank you. Who should be making decisions for the baby during the time the newly delivered mom is in the hospital? Adoptive parent or your patient client? So if you can quickly answer that. I'd be dying to see your answer before I elaborate. So I'm going to wait like a couple seconds. Okay. Okay, great. So it was split. 70% of you said your patient or client. The answer is your patient or client. That's so important for you all to know. Just because a woman has been perhaps having a lovely connection with the adoptive family while she's pregnant, maybe they've known each other for 2 months and have had lots of lunches and love each other, she is the mom. She gets to decide what happens in the hospital. She should never be pressured to move forward with her plan, ever. It's always her opportunity to change her mind when she's in the hospital. Okay, next slide, and I literally have 2 minutes, 3 minutes. So, again, we have a waiting family, we have birth parents who, if in an open adoption where a woman is interested in choosing, they'll meet, they'll provide counseling. Counseling will be provided by the adoption agency, and everybody will be in the hospital perhaps. And then what comes out of there is the discharge of baby to the agency, discharge of the mother, and post-placement counseling and experiences provided for all after. And adoption agencies should stay in touch with adoptive and birth families for as long as they'll have us. I mean, we have families that we've known for 20 some years and birth moms who we've known for 20 some years. And it's wonderful to be able to offer that adoption community. Okay. I think I'm going to skip these. I'm going to skip these, the law slides, Jenny, because we don't have time. So I'm going to conclude with our last slide, which is just to tell you like the process. So adoption agencies, for those of you who work in hospitals or work in clinics or who just want to know what happens, adoption agencies should always provide a copy of their license. There should be release of information forms exchanged and release of custody form exchanged. And there's documents in place to help everyone know what everyone should be doing. The bottom line is adoption agencies want to work with hospital staff to make sure that the new mom's rights are being honored. She's the mom. She's the one who should be making all decisions for the baby, and it should always be known to her that she is the decision maker. The adoptive family, if they're in the hospital, sometimes they're invited, sometimes they're not. Adoption agencies try to take good care of them, but the bottom line is this is not an adoption until the new mom who just gave birth decides that adoption is still right for her and she wants to move forward with her plan. Okay, I think that's the next slide. We have one more slide, Jenny? Yeah. So thank you so much. I mean, we're a regional adoption agency, but I hope that the information provided to you today just gives you a better understanding of how adoption is really working throughout the country. It can be a truly empowering choice for women and men who are needing to consider adoption for their baby, and a wonderful way for two families to come together and a great way for a child to join a family. So I thank you so much for this time together, and thank you, Laura, and thank you, Amy.
Thank you so much, Meredith. I do have one question that I just thought might be good to address with the audience. What are some tips? What are some tips to help nurses work well with adoption agencies so that everybody's taking good care of the new mom or the delivering mom who's considering adoption?
You know, truly, as I was just sort of mentioning, you know, honoring her and hopefully the adoption agency is with this woman each day she's in the hospital, you know, reminding her that we're there to support her. And I kid you not, lots of times things shift for her, not just because she's holding this beautiful baby in her arms, but perhaps some new support has just come around her. And parenting this baby becomes a possibility that is safe and happy, and she wants to do it. And it can be a super hard time for that hopeful adoptive family. But in our experience, when a woman changes her mind in the hospital because we give her the space to do it, that family will go on to adopt another child. And of course, they know then that this was the path they were supposed to take. And the child they needed to be available for later just needed them to be available at that moment. And it's all, you know, synchronicity and all good.
Thank you. Thank you so much again to Meredith Rose, to Amanda Murdoch, Amanda was our surprise guest for today. And and I'd also like to thank Jenny for working the back end of the slides, and of course to Laura Hall, who is the magician behind our technical program. A reminder to our attendees that within the hour, you'll receive an email with a link to the post-program evaluation, and you'll receive your certificate in the body of an email by the end of this week. Next week, we're delighted to be hosting 2 webinars in recognition of National Diabetes Month. Tuesday's topic will be gestational diabetes, and Thursday's program will focus on diabetes in children. More information about these programs, as well as access to our library of on-demand programs, may be found on the professional education page on the Partnership's website, www.partnershipmch.org. Thank you for joining us today.